Hello, my dear friends. Welcome to my Nmc Osce exam preparation. Here, I would like to give you some basic tips for how to prepare your Nmc Osce. First of all, we need to choose one university. Out of three, you have to choose one. Usually, people are preferring which is close to their home. It's all depend upon you. Before you choose, please read the university, their requirement, success rate, and their hospitality towards the students. Okay, please get idea from your friends. They are the good resource. Please use them. I also want to emphasize that you need to know what are the stations and how you need to prepare for it. And I have to tell you that the basic thing of OSCE, you can learn some basic things at home. Prepare it well before you go for training. Some people, they NHS giving or training for them, others they go for private training. Here are the some basic things I'm going to explain to you. So first of all, choose your university. I already mentioned you how to prepare your university, how to choose your university. Okay, so three of the university, you choose which one is the best for you. Then the second one is you need to understand your stations. What are the stations? You have two section of stations. One is the first section, or you in the exam center you will get either APEI in the first or the second time. You have two stations, which is assessment, planning, implementation and evaluation. The second one is two clinical scenarios. You will get it. I will explain everything in the next video. And the third one, you need to understand the exam settings, how the exam going to conduct. You can ask your friends how they going to, means the exam center, how we need to prepare. If you're working in NHS, the same settings they are they prepared in the OSCE exam center. Like, for example, if you're working in a ward, the same bed, the same adjustment systems and everything, even the hand washing sink and everything is same like what is in the actual NHS settings. So if you are working in NHS, you won't have much problem. If you are not working in NHS, please familiarize with the settings. Okay, the next one is what they are expecting from you. There is a lot I need to explain to you, so that I will explain in other video. So you need to know what are the examiners expecting from you. For example, how you going to behave to the patients. Okay, so it's a lot, so I will explain to you the next video. And you need to make a plan about how do you prepare, how you going to prepare your exam. So there is at least a lot of clinical things you need to know. That is not only the theoretical way, you need to know the practical section as well. So for that, I will give you some guidance in the next section. Okay, then you need to ask your friends. They can give you a crystal clear clarity things to you, means what the exam, how you going to prepare, and you always get a lot of idea from your friends. So just please ask them, they would help you. The next step is how to select a trainer for your OSCE exam. So if you're working in NHS, you don't have much problem, because usually NHS provide a better training for your OSCE exam. Whereas if you are not working in NHS, please, you need to have a good trainer. Okay, so when you choose the trainer, you need to ask your friends which trainer they have gone through, because there are a lot of trainers are there, but most of them are very, very good. So choose one of the best trainers. So before, I told you already, it's a 3 days training usually, and they will give some extension. It's all depend upon the trainers. So you have to choose a better one, and you need to prepare the prepare very well before you go for training. Okay, so the preparations you can do is the simple things you can prepare at home. So for example, how to do the hand washing, how to behave to the patient. These the simple things you can prepare at home. So I will make a video about it. If you need it, let me know. Then you need to I would suggest book the exam within 2 weeks after your training, because if you keep it for a month, you might able to forget. So prepare within 2 weeks. That's the best time. So you have that exam tension and exam spirit, that after 2 weeks it's going to slowly go down. So please prepare within attend the exam within 2 weeks. The next one is read and understand the exam before you attending the training. Means you have a lot of plenty of resources out of there. Maybe you can ask your friends who attended the interview, attended the OSCE exam, or you can get a lot of things from YouTube and a lot of things from Google. So get a lot of information what they are expecting from you. Okay, so get to know about it first. Yeah, the next one I would say, clarify all your doubts when you are preparing your OSCE exam. So when you go for training, ask your examiner that what are the doubts. Ask all of your doubt, clarify it there itself, and you can create a WhatsApp group with you along with your friends, and you can motivate each other and you can ask each other. So they are the good resources, please use them. When you go for a training, you have a small number of people, small number of 5 to 8 students together. They're going to attend the interview. So prepare a WhatsApp group there, or make a WhatsApp group and ask doubts. So the trainer will give you a lot of explanations and things like that. And one more thing I would say, ask know when your friends, your exam OSCE friends going to attend the exam, then get some idea from them as well. So that's the way you can you can prepare your OSCE exam. The next step, you need to choose the exam center. So 3 universities are there: Northampton University, Ulster University and Oxford University. So you can choose which one is closer to you and which is a good success rate, how the exam conditions, and it is not standardized. I won't say it is too different from other universities. All are standardized, so you can choose which one is that, and you can always get a suggestion from your trainer or your friends. Okay, then you need to know the success rate, how many of them are succeeding. It's all depend upon how you perform. It's not not much difference. So it's all about how you prepare the exam, how you attend the exam. It's all about that. So even though you just go through the success rate. Then third one, I would say, ask from your friends. That's the best thing you can the best clear idea you will get, and the location, and travel expenses, and the exam day. I won't recommend to travel too far. If you write the exam in so far from your location, go the next previous day and stay in a hotel, and then organize according to that, and don't travel too much on the same day. That sometimes travel problems, especially these times, travel problems like tubes are very delayed and things like that. That makes you so nervous, so you won't able to perform well at the exam. So please do according to that. Okay, all about your preparation and your performance in the time of the exam. Okay, The next section is exam station. You need to know how many exam stations you have. In that time, you have 6 exam stations. So you will get either clinical section first or APIE second. Okay, API means assessment, planning, implementation and evaluation. Clinical skills, that means IM injection, urinary catheter, like all the clinical skill sections that gonna be, you will get only 2 of them. Okay, that is the exam station you need to know. So I will make video of each of it, and if you have any suggestion, any doubts, please message me. Write it in a comment. I will get back to you. Thank you for watching. Prepare well, don't stress yourself. Have a nice day. Bye.